and welcome to Dr. B Talks About Hyperparathyroidism. I'm your host, Dr. John Burgoyne, a practicing board-certified otolaryngologist with over 30 years experience dealing with ear, nose, and throat disease. I practice in Austin, Texas, and I'm happy to be talking to you today. So, hyperparathyroidism. The first question when we want to talk about hyperparathyroidism is, what are the parathyroid glands? Well, the parathyroid glands are called parathyroid glands because they sit next to the thyroid gland. The thyroid gland sits here in the neck and it's just below the Adam's apple. And on the back side, we find the parathyroid glands. They always draw them in this position, but it's a little variable. There are typically 4 glands. These are much bigger than they are in real life. They're typically about twice the size of a grain of rice. And they're kind of on the back of the thyroid, but sometimes there are only 3. Sometimes they're a little lower, at least the lower ones are lower. Sometimes there can be up to 6 of them. And sometimes one of them is really low, like this one here is behind the collarbone down in the chest. Now, if you're the surgeon like me, it would be important to know about that. So, we're talking about hyperparathyroidism, which just means increased parathyroid hormone level in the blood. The parathyroid, its job is to basically defend the calcium level in the blood. And so when the parathyroid hormone level goes up, the calcium level goes up. So if you have hyperparathyroidism, you're going to get increased blood calcium. And what does that do? Well, it can cause several problems. One of them is kidney stones. Kidney stones are terrible. I hated mine. But kidney stones can be a sign of hyperparathyroidism. I recently operated on a woman who had had over 40 kidney stones before somebody figured out she had hyperparathyroidism. It can also lead to weakness, depression, or confusion, muscle pain, bone pain, joint pain, and to get that calcium to increase, the way the parathyroid hormone does that is it gets the calcium from the bones, which can cause osteoporosis. Today we're going to talk about primary hyperparathyroidism. This is the main type of hyperparathyroidism that people are going to run into. Sometimes you can have fake hyperparathyroidism, or if you have kidney disease, you can have a different type of hyperparathyroidism, but we're not going to talk about those today. So this is primary hyperparathyroidism. It's due to one of the glands becoming enlarged. So if these are the normal glands, if you have primary hyperparathyroidism, you'll find that one of these glands has become enlarged. We call that a parathyroid adenoma. That just means a growth in the parathyroid gland. These are not cancer, or at least they almost never are. I've seen 1 case of parathyroid cancer in the last 35 years of practice. So you got 1 enlarged parathyroid gland. It's enlarged and it's making its parathyroid hormone without any attention to how much calcium is in the blood. So normally, if your blood calcium goes up, the parathyroids say, oh, plenty of calcium, and they don't make very much hormone. And if your calcium level is low, they say, oh, need more calcium, so they raise their levels. But in this case, this enlarged parathyroid gland, parathyroid adenoma, is going to cause increased parathyroid hormone level even if the calcium level is okay. So most of the time people figure this out, they just are having a routine blood test. We often get a calcium level with our yearly physical, and the calcium level is high, and then further investigation will find that the parathyroid hormone levels are elevated, and the combination of high parathyroid at the same time that the calcium is high lets us know that somebody's making parathyroid hormone when they shouldn't be. And so that's typically just the 1 enlarged gland. It's possible to have more than 1 gland become enlarged at the same time, but it turns out that those are rare. Now, if that's going on, and you have any of those symptoms that we talked about, kidney stones, depression, bone pain, joint pain, or osteoporosis, then you take out the gland. And as I mentioned, cancer is very rare. So we decided we've got primary hyperparathyroidism, and so we assume that one of these is enlarged. What should we do about it? One option is to do nothing, meaning if you're not having any of those symptoms we talked about, you don't have to do anything. Check the bone density and make sure the bone density is okay so you don't have osteoporosis, and then just wait and watch. And if any of those symptoms occur, kidney stones, bone pain, joint pain, muscle pain, depression, or a change in the bone density, then you need to consider having the parathyroid adenoma removed. So let's say that we've decided that we're going to remove it. The first thing we want to do is we want to know where it is. So we want to find the enlarged gland using a parathyroid scan and ultrasound. This is a set of tests that is available everywhere, and it will help us to locate which of these glands is enlarged. You can imagine, if you're the surgeon, you want to know which one of these is enlarged. And then once you know, it's surgery for the cure. So let's talk about that surgery just a little bit. All right, let's say that we've figured out that it's this parathyroid on the back side right here that is enlarged. So what are we going to do about that? Well, we make an incision. These incisions are down low in the neck, kind of parallel with the creases. Not very painful, not very obtrusive. Similar to an incision if you know anybody who's had thyroid removal surgery. Same thing. So because we know where it is, we can go right to the area, kind of pull up the thyroid to get to the back side, remove the enlarged gland, and then we do one of a variety of different tests to make sure that we got it. You might say, well, gee, don't you know where it is and it's enlarged? You do, but there are several things in the neck that could look like an enlarged parathyroid gland. So we always have to do a test to make sure that we've got it. Doing all that really doesn't take that long. I can usually have a parathyroid gland out in about a half hour from starting the incision. It then typically takes us a half hour to do one of these tests, and then we close up. So it's not a very long procedure. Patients feel great afterwards, it hardly hurts, and they would be able to go home, but there's a situation that we need to think about. And we call this the sleepy parathyroids. So remember, we used to have a big giant parathyroid over there that was making parathyroid hormone when it wasn't supposed to, and that made the calcium level go up. Well, the other three parathyroid glands, having been exposed to high blood calcium levels, will have been doing nothing. They're basically asleep. They haven't needed to make any parathyroid hormone for a long time. So the problem immediately after removing that big gland is that these sleepy parathyroids won't make enough parathyroid hormone, which can cause the calcium levels to drop. So we give people extra calcium and vitamin D quite a lot. I typically give people like a dozen Tums a day, as well as really big doses of vitamin D. And then we also monitor the calcium levels, and we watch for what's called tetany, which is a problem where the muscles cramp up and can lead to muscle cramps, tingling, numbness, and it can make your heart stop if you let it go on too long. All right, so you've done all that, and patient's doing great. 6 months down the road, you have a little tiny scar that is almost invisible from more than about 2 feet away, and you no longer are having those high calcium levels. Thanks for listening, and thanks for watching today. Remember that Dr. B Talks About is presented for informational and entertainment purposes, and it's not designed to diagnose or treat any medical condition. If you have concerns about your health, please make sure and see a doctor. Online forums, YouTube videos, even good ones like Medscape, those are not the practice of medicine. You'd think I wouldn't need to say this, but I tell you, I do. I have patients come in all the time who are sure they know what's going on because they watched a YouTube video. This is not the practice of medicine. If you are in the Austin area, you're more than welcome to come see me. I'm easy to find. Just Google John Burgoyne, MD in Austin, and you'll find me. Thank you so much for listening to the presentation. If you've enjoyed Dr. B Talks About, please push the buttons, like, subscribe, share. We'd love to have you check out our other videos and hope to see you soon. Thanks.